I'm here to talk about the Department of Health and Mental Hygiene. We are located in Baltimore City, of course, and we have many boards, councils, commissions, task forces, work groups that we oversee, and we are always looking for people who want to be involved in the community and want to serve their fellow Marylanders. So that's what I'm here to talk to you about today. I brought a list of all the groups, which I gave to Ernie, and she's going to make available after the meeting if you're interested. I also am going to leave my cards and an application. So I hope to hear from many of you after this. And if you're not sure and you have questions when I'm done, I'd be happy to answer them, or I'm going to leave my cards. As you know, in statute, regulations, et cetera, there's many boards and commissions that are under the department. And first of all, I wanted to just talk a little bit about what the department does. I'm sure you're all familiar with your local health department and some of the services they provide. Department of Health and Mental Hygiene is the largest department in the state, and we have the largest budget. It's several $billion. So we do public health. If you want to get a vaccine, you go to the local health department. If you want to find out about Ebola or Zika, then you can call the local health department. We also have Behavioral Health Administration, which is the new name for the Mental Hygiene Administration. So if you need services for mental health or substance abuse, you can contact them. We also have the Developmental Disabilities Administration, which provides services to people with intellectual disabilities. Vital statistics, birth certificate, death certificate, they handle those things. We have healthcare financing, which is our word for Medicaid, and a lot of the other health insurances that are available through the state. We also have the Office of Healthcare Quality. Does anyone familiar with the Office of Healthcare Quality? They license nursing homes, they license provider agencies like the AARPs and the Melwoods. They license agencies that provide mental health services. So if you ever have a concern or complaint about any of those entities, you can always call the Office of Healthcare Quality. We have the Office of the Chief Medical Examiner, and we also have one of the things that I'm here to talk to you about today, which is the Health Occupation Boards. Every health occupation has a board that oversees them, and I'll get a little more into detail about that in a minute. So the department coordinates appointments to more than 75 boards, commissions, councils, and task forces. These groups address diverse issues. We have a work group for almost every health issue that you can think of, and this is just a small snapshot. But we have a group that advises on arthritis and related disorders, one that works on physical fitness to promote physical fitness throughout the state. We have one that deals with behavioral health issues, which, as I said, are mental illness and substance abuse. We have a commission on kidney disease, which works with the physicians, people who have had kidney disease or kidney transplant, and also with the dialysis providers. Heart disease group, heart disease and stroke prevention. We have a group that advises the Deputy Secretary on Medicaid services, and we have groups that deal with quality assurance in various issues, especially licensed providers and also the facilities that are operated by the department. And then we have an advisory committee for labs. And as I said, this is a small snapshot. I'm going to leave a list of all of our groups that Ernie has. And once again, here's a bigger list of some of the groups that might be interesting to you. All of these groups have seats for advocates, patients, family members. So when you look at the list, think about the fact that if you have a family member or you yourself suffer from any of these, you might be interested in being a member of one of these groups. The department also has 11 facilities that we operate that have a Citizens Advisory Board. We have 2 chronic care hospitals, one on the Eastern Shore and one in Western Maryland. And we have facilities that provide services to individuals with developmental disabilities. And we also have 5 facilities treating adults with mental illness. Probably the closest one in this area is Spring Grove Hospital Center in Catonsville. We also have Perkins in Jessup. And there is a RICA, which is in the next list, for treating and educating children, and it's located in Rockville. And they're always looking for people for the Citizens Advisory Boards. We like to also have people who've had personal experience with mental illness on those boards. Now on to the health occupation boards. As I said, each profession has a licensing board, so we have 19 of them. Okay. How many of you knew that we had a licensing board for morticians? A couple of people, okay. We have a licensing board for social workers. We also have a licensing board. The one I get asked a lot of questions about is number 12. What is an environmental health specialist? Does anyone know? It's the sanitarian, okay. They do restaurant checks. They check, they do the perk checks. So it's really a fancy word for sanitarian, okay. And as you can see, we also have, dentists, dietitians, et cetera. So we have a wide variety of specialties that have to be licensed. Each of these health occupation boards their main role is to protect you, the public, okay? So they license, certify, and educate the health professionals. They make sure that they follow best practices and standards of care. They make sure that they're getting continuing education. They investigate complaints. You can call up any of those boards if you have a concern about your health professional, and they'll take your information and do an investigation if warranted. They also discipline licensees. So if the person's found to be in violation, perhaps over-medicating, there's different levels of discipline depending upon the issue. But anyway, each board has at least 2 what we call consumer members. Those are members of the public, you and me, someone who has no background in healthcare to sit on the board along with the professionals to help protect the public. So those are people that we're always looking for, people who are willing to serve. So what does it mean to serve on a board or a council or a commission? There is a term of service. Usually it's 3 to 4 years, depending upon the board and how it's written in their statute. The time commitment also varies. Some of the boards are very intense. The Board of Physicians meets for 2 full days every month. Okay. The health boards all pay mileage to their members. They also pay a stipend, and most of them give you a pretty nice lunch. Some of the advisory councils that I mentioned, like the physical fitness, the arthritis council, they're more, they don't have a budget, so to speak, so they're looking more for people who can volunteer their time. And some of them do permit people to phone into certain percentage of the meetings per year. There are attendance requirements for each of these. If you are appointed, you are required to attend at least 50% of the meetings in a calendar year to remain an active member, which really, if you think about it, is pretty low. And like I said, there is compensation, travel expenses, they'll help you with parking if needed. And then, of course, if you're a member of the board and you are appointed by either the Secretary or Governor Hogan, then you have to follow the state ethics law. Okay? So obviously you can't be taking gifts from lobbyists, you can't be on certain boards if you have a family member who's licensed by that board. So if your daughter-in-law, your husband, et cetera, are nurses, then you would not be able to serve on the Board of Nursing. There are also, for some of the boards, you have to do a financial disclosure with the State Ethics Commission, which is pretty simple. It's a lot simpler than doing your taxes. So what is the application process? Like I said, I'm leaving a list of all the boards, a basic application in my card. What I would suggest you do if you are interested is give me a call. I like to talk to people. How much time can you commit? What's your area of interest? How far are you willing to drive, et cetera? And then I can try to match you with something that would be a good fit for you. So once I get your application and your resume, and some people who are retired get a little freaked out when I say resume. I don't need I need the highlights, okay? One-pagers usually do it. So when we get your information, we vet you. Obviously, we do not want to appoint anyone who would be an embarrassment to the secretary or the governor. So we make sure that you don't have a history of reckless driving or a history of, let me see what I have. I had a gentleman who was arrested several times for driving his boat while intoxicated, who applied. Well, it's public information, and we didn't think it was such a good idea for us to appoint him. But if it's something that happened many, many years ago, it was a one-time thing, we don't really get into that. We don't care if you're divorced 3 times. Things like that we don't really get into. But we do look at the judiciary website to make sure that you're a good person. And then we also, if you have another type of license, perhaps you were a nurse in the past, we do check with the board to make sure that you were had a license in good standing, even if your license is not active. We do some other vetting things. We like to make sure that people who apply have paid their taxes. We had someone who applied once who owed $250,000 in back taxes. Didn't really want to appoint him, okay? Then you may be interviewed. Usually it's a quick interview with the board chair, or sometimes if it's a health board, the secretary likes someone who is a specialist in that area to talk to the person, just to make sure that they understand their role if they were appointed and the time commitment, et cetera. Then the secretary of our department, Van Mitchell, makes a recommendation to the governor, to the governor's appointments office. They review it. Sometimes they do further vetting, and they review the recommendations. And then if the governor's office wants to appoint you, then they would be in touch with you and talk about next steps, like when the term would start. We have some things that require that you also go to the Senate, for confirmation. I don't want to use the word rubber stamping, but that's the best thing I can think of. It's usually, there's not a lot of conflict usually with people who are coming through our office for appointment. The Senate tends to get more involved with people who are appointed to, like judges, things like that. They get a little more in-depth about. So once again, here's my number, and I'd love to talk to any of you. And you know what? Even if you don't think this is a good fit for you, maybe your wife, your cousin, your neighbor, your friend at church, you think they'd be interested in this, pass along my information to anyone. The other thing that we really need on all of our boards, councils, and commissions is diversity. We want gender diversity. We want ethnic diversity. And most of all, we want geographic diversity, because the issues in Prince George's County are different than the issues in Garrett County. So we need to have voices at the table from all areas of the state.
Do you get involved with the caregivers? That this bill that's supposed to going through the Senate now down in Maryland, as to how people are treated once they're released from the hospital?
Get involved with the caregivers. You mean the caregivers bill? Yes. We have some groups that touch on caregiving. I think all the boards, all the health boards touch on caregiving, and we have a couple of other groups that have been like short-term that have discussed caregiving. There's the Caregiver Coordinating Council that is run through the Department of Human Resources. They have a Caregiver Support Coordinating Council. I don't know whether they have any openings, but if someone was interested in that council, I'd be happy to give you the information of who you could talk to. That's under another department.
My question is, are any of these appointments paid?
Well, like I said, the only ones that offer a stipend are the health occupation boards for the most part. Most of the other boards are volunteer. Yeah. The health occupation boards pay a stipend because it's a more intense time commitment. And they also are, the health occupation boards are funded by the people who are licensed by that board have to pay a fee, and some of them pay pretty hefty fees. And so the boards all have their own staff. Some of them have many, many staff. Some have fewer staff, depending on how many licensees they have. But the Board of Physicians, the Board of Pharmacy, and the Board of Nursing are probably the most time-intensive of those boards because they're licensing not only, like the Board of Physicians, they license physicians, obviously, but they also license athletic trainers. They license the people who give you your sleep study. Has anybody been for a sleep study? The person who does your sleep study has to be licensed by the board. They license the people who do radiology. They are in the process of beginning to license naturopaths. So they have several groups that they license under them, and those people also pay a fee to be licensed. So they have more money to give out as stipends. Many of the advisory councils are just that. They're an advisory council, so they don't really have a budget. If your local county has a board that's just for your county, then we're not usually involved in that. Okay. Because I know local health departments often have boards and councils under them, and we don't deal with that. I only deal with the boards and councils that require the person who's serving to be appointed by either the secretary of the department or the governor. Now, there's other councils and boards under other departments as well. The other department that has a large amount of occupation boards is Department of Labor and Licensing. They license the plumbers, the electricians, the cosmetologists. And if you think you're more interested in something like that, I'd be happy to give you the name of the person over there, because they're always looking for the same. They have public members on their boards, just like we have public members on our health occupation boards. Some of them are going to be held a little closer to you. The ones for the facilities are probably the ones that are closest. A couple of the advisory councils tend to meet in various areas throughout the state during the year to try to get, more people, because most of the meetings are public meetings that are open. There is an Open Meetings Act in Maryland. So all of these groups have to have an open meeting, which means they have to say when the meeting is, where it is, and let the public know that it's an open meeting and that anyone can come and attend. They don't always have time to allow for public input during the meetings, but often there is a chance for the public to, make comments during the meeting. The ombudsman person, are you talking about the ones under the Department of Aging? Yeah, they're under the Department of Aging. There is a state ombudsperson right now. It just changed. It used to be Alice Hecht, and it's now Stevan Ellis. She's at the department in Baltimore. And she does sit, or that person is supposed to sit on the Nursing Home Administrators Board as what we call an ex officio. There are certain seats that are for public or for state employees to represent their departments. She does sit on the Nursing Home Administrator Licensing Board. But otherwise, if there's other things, I think she also sits on, there's an Alzheimer's Council, and she also co-chairs that, because that is required to be co-chaired by the Department of Health and the Department of Aging. If you're not sure how much time commitment there is for some of these groups, I can't possibly give you a list of all the time commitments for each group. So give me a call. And also, if you're looking for something closer to home, I'm happy to make some inquiries for you to see what else there is. I do meet with the health officers on a regular basis and can let them know of people that are interested in things in their county. But I hope that you'll pass this information on, even if you don't think it's applicable to you at this point. And just consider it's a great way to give back to your fellow Marylanders and to make sure that your county is represented. Thank you.